daily death toll from Chinese coronavirus reaches 1,000, double the seasonal flu, as the private sector quickly moves to build more ventilators. Hello, this is Robert Romano, Vice President of Public Policy with Americans for Limited Government, dailytorch.com. Hit that subscribe button. Today we're going to be talking about the Chinese coronavirus. Again, sadly, the daily death toll in the United States has reached more than 1,000, and that's more than double the seasonal flu, which is more like 500. The news doesn't get much better, though, because the estimates are pointing to a daily death toll that could get as high as 4,500. So if seasonal flu is 500 daily deaths at peak in a seasonal flu, a bad one, and this one can go up to 5,000 or 4,500 a day. That's almost 10 times worse than the seasonal flu, which is what the Trump administration, medical professionals, state governors have been concerned about, and that's why schools are locked down. The states of governors have all acted. Every schools are closed in every single state. Businesses are closed. Every day more state governors are issuing stay-at-home orders. Florida has now done a statewide stay-at-home order to preserve as many lives as possible as the numbers come in, and they're horrifying, and you should be worried. But the worst could be yet to come. Thankfully, the private sector is moving quickly to produce as many ventilators as will be needed at Ford, General Electric, 3M, General Motors, and others. And also, President Trump has invoked, controversially, the Defense Production Act to expedite the orders that are being made right now. Now, the Institute for Health Metrics and Evaluation has a modeling website updated daily with new metrics on the mortality projections. That's what we were just looking at over here. And they're saying we're 14 days until peak death on this, and the peak resource usage will happen on April 15th. This website actually is trying to, and it's showing what the needs are on the front lines. You can break it down by state. It shows every single state's charts as well. You can look at New York, you can look at others, just by going to the website and looking up on a daily basis how this is changing over time, because they're updating it every single day. Now, they say that the death toll could top 4,500 at the high end, almost 10 times worse than the seasonal flu. That is if the rate of infection exceeds the private sector's capacity to produce enough beds and ventilators according to the model. Also, the Army Corps of Engineers, can they build enough beds? This is a joint effort. This is a public-private effort. Every government, and every state, and the private sector are all combining resources to quickly crank out these beds, these intensive care unit beds, and the ventilators that are needed to mitigate the loss of life. Now, the overall death toll from this could be as high as 177,000 if the healthcare system becomes overwhelmed. And that's with the entire country on lockdown. Without the lockdown, the White House Coronavirus Task Force is saying as many as 2.2 million people could perish. And that's more than every war combined that we've ever fought in, the fatalities of U.S. soldiers and sailors and airmen. Now, the stated purpose of the website, and you can look at their frequently asked questions, is, quote, these forecasts were developed to help hospitals and health systems prepare for the surge of COVID-19 patients over the coming weeks. Peak resource use is when the estimates predict the greatest need for hospital beds, ICU beds, ventilators, and other hospital-related resources. Additionally, the model is updated regularly as new data becomes available in order to provide the most up-to-date planning tool possible for every single state and the entire country. Now, one interesting aspect of this is that you can actually go back every single day and check to see if the numbers were correct. Did we run out of ventilators? Was the daily death toll as high as was being projected, or is it lower? Now, you can do this by using the web archive. That's the so-called Wayback Machine. At first, they were saying on March 27 that April 9 would be peak resource use. 19,000 ventilators would be needed. And then it was April 14 would be peak resource use, and then they needed 18,767 ventilators. And then it was upgraded to April 15 for peak resource use, 26,000 ventilators needed. And today it's up to 31,000 ventilators needed. It's still April 15 peak resource use. Now, at first, they were projecting 81,000 deaths total this year on the medium range. Now, as April 1, they're saying 93,000 total deaths will likely happen before the end of the pandemic, sometime in July or August. Now, the struggle And a large part of the reason for the uncertainty, because they show a variation between 41,000 up to 177,000, with 93,000 in the middle as the medium. And it's because of the uncertainty to do with ventilator production. Readers have undoubtedly, you'll note that, and listeners, that the emphasis given to by public leaders, the governors, the president, the media, medical profession, media outlets on ventilators. You critically need these, because if the hospital system becomes overwhelmed, there's not enough ventilators, then you can't save as many lives as you would like to. And the reason for it takes a long time to make these ventilators, as President Trump was noting at the press conference yesterday. It's quite possible that the ventilators being made right now, as quickly as they're being made, might not get there in time. Apparently, it usually takes about 2 years. This is from BBC. It typically takes 2 to 3 years to develop and launch a ventilator, so convincing the industry's big players such as General Electric and Philips to let their products be made locally under license is, basically how this is going to be done. They're going to companies already have tested models, and so we just need to ramp up and get to mass production here. And they got to do it quickly as possible, because according to the very smart projections by the IHME, you're going to have peak resource usage in less than 2 weeks. So they need those ventilators yesterday. There's a reason the president controversially invoked the Defense Production Act. It's because you have to make these as quickly as possible to save as many lives as possible. That's why the president has declared war on the virus, and we're on a war footing right now. That's why they're using the Defense Production Act. That's why the schools are shut down. That's why the businesses are shut down. We're causing a massive recession. We had 3.3 million unemployment claims 2 weeks ago. You had 6.6 unemployment claims. This week we're up to 10 million jobs lost already. That's more than the Great Recession when the financial crisis occurred. And I'd say the worst is yet to come, and we need mitigation in that area as well. But the problem with the ventilators is that you need to test them. If they don't work properly, every new ventilator it needs to be tested. Because if you don't do that, people are going to die when you intubate them. And President Trump, again, he invoked the Defense Production Act for a reason, and it's because they needed those ventilators yesterday. Now, anecdotally, this matches what I'm hearing from people in the healthcare profession. They're really scared, and this is really a grim situation. Please take your local government's guidelines very seriously. If they say don't have more than 10 people gather, don't throw a party. Don't be irresponsible. The spring breakers and folks, the young people in Prospect Park in Brooklyn, they need to start listening more. And this is an educational moment, and education. Be respectful to people. People are right. It's okay to be skeptical about things, and it could lead to better outcomes, provided that we are following through and becoming more educated as time goes forward about where we are and where we need to go with this. This is not political. It's not politics. You've got Republicans and Democrats alike. Again, every single state has shut down schools. Governors, Republicans and Democrats alike, are taking this seriously, and this is a national effort. This is a war on the Chinese coronavirus, and we're going to win. But the point here is that, not to make predictions, according to the model, if this is on the lower end, the death toll that's being projected, it's going to be because enough ventilators were produced, that we got enough resources in place in time to save as many lives as possible. And so let's get that production up, and let's keep this number down as much as possible. I hope it stays down as much as possible. Now, mitigation, the production of those ventilators, it's critically needed items. We need those efforts to be as effective as possible, and lives will have truly been saved by everything the president has set in motion. And again, as many as 2.2 million people could have died had President Trump not declared a national emergency, issued the guidelines, and state governors, if they had not shut down. Trump could issue a national emergency, but if the state governors didn't react and follow his leadership, we could have a much, much worse situation. And thank goodness President Trump shut down travel from China and Europe and other hotspots around the world, because that provided us the time that we needed to ramp up production of these critically needed ICU beds, ventilators, and just hospital beds. The Army Corps of Engineers, so great, so courageous, they're in the hotspots, and they're building field hospitals everywhere that they're needed right now. and they're working really hard. The administration's working really hard. State and local governments, they're working their tails off. The healthcare professionals, they're sleeping. They're living at the hospitals. They want us to stay home, and they'll stay there. And they're truly brave. I mean, this is an unbelievable national project, and I think probably the most effective response to a public emergency, maybe in history. And I think President Trump deserves a lot of credit for the leadership. He's taking a lot of, you can look at the political risk. Like, you could wind up with 20 million jobs lost, 30 million jobs lost. You could wind up with a depression worse than the Great Depression as a result of this. Trump had a choice. You could save 2 million lives, mostly elderly and those with underlying conditions, but you'll get a great recession. Or you could prevent the recession and let all those people die. And he chose life. And I think that's very uplifting. I think that there are things more important than money. Now, we're going to have to fix the economy after this, and we need to have as much mitigation as possible going forward so that we can minimize the damage. And Congress, fortunately, they put up $2.2 trillion to help small businesses, 30 million small businesses employing 60 million Americans, to cover payroll. Larger businesses above 500 employees, they're helping them cover payroll. There are tax credits in place. And even still, you're going to see a lot of unemployment as a result of this. And we need the government they broke it, they bought it, they closed the economy. That's just compensation. It could go up to $6 trillion on terms just covering the payroll and the unemployment benefits and everything like that. I think those efforts are necessary. We don't want society to collapse as a result of this pandemic. We need to come back quickly. And so fortunately, Congress, Republicans, Democrats alike, they're all working together. They're following President Trump's leadership and Vice President Pence, and they're doing everything that's possible to save as many lives as possible. Now, Dr. Anthony Fauci, he was talking about the possibility that the model could be massively missing asymptomatic transmission of the virus, which might actually say that this virus is not as lethal. And so he mentioned doing serology tests. I just did a video on this, geographically randomized, showing the extent of the pandemic, although he said it's not a top priority at the moment. But maybe that can change. President Trump has already shown that if he believes something needs to be done, antiviral treatments, what have you, that's going to, he's going to say, no, do it anyways, even if you don't think it's important. And I think one reason that they should do that as soon as possible is because some of the medical professionals who are promoting the serology test are skeptical. And so you have people who are saying, wait a second, maybe this is not as bad as we think, maybe the measures are overkill, and here's a way to test it. And people can lean on that and say, well, there's still questions about the certainty of how lethal the pandemic is. If you do a randomized sample, a geographic distribution, demographically varying for age of the entire population, either in a state or even nationwide, you can see how many people have been infected with the coronavirus. And then you can compare that to the death toll and say, yes, it's as lethal as they say they were. Stay home. It's safer that way. And there are monumental economic consequences for leaving the economy closed this long. We're going to have our first monthly unemployment report at the end of the week. That's going to show you what happened in March. But that's really just the tip of the iceberg. In March, that was mid-March, just when the shutdowns were starting to occur, you get an unemployment reading. A month later, in May, that's when we're going to really see the damage done economically by shutting down the entire economy. And it's going to, we should pay very close attention to this. The U.S. economy, the global economy, should not be shut down lightly, and we have to make sure we don't fall into the dark ages as a result of this. Really, really bad things can happen as a result of the shutdowns and the response. We have to mitigate that and keep our own selves and our own governments in check. Make sure they don't get out of control with this. Like, what if Congress had not done the economic mitigation while the entire economy was shut down? That would have been a catastrophe. It would be like an asteroid hitting the planet or something. Like, you could see real devastation economically. The asteroid equivalent of a Great Depression. And so again, these are monumental consequences. And you might not know until May how bad it is, and you might not know until the end of the pandemic, or even a decade later, whether it was worth it or not. Do we come out of this stronger? We need to come out of this stronger. So we just have to keep on focusing on what we need to do to keep our families safe, to keep our communities safe, to keep the state safe, and to keep this country safe. Thank you, President Trump. Thank you, Vice President Pence. Thank you, state governors, for everything that you're doing, because this is necessary. If what these models are showing, which is that with the entire country shut down, 200,000 people will die, and if we don't shut down the country, 2 million people could die, most of them elderly, our parents, our grandparents. Yeah, I don't think the American people feel comfortable with that, and and there should be. This has to be politically sustainable. This needs to be economically sustainable, and in the long run. So we just need to mitigate what we're doing, the consequences of what we're doing, because there are unintended consequences for shutting down the entire economy. It's not merely, oh, we save lives, we stay home for a month, and that'll be the end of it. We can snap back really quickly, and it will be because of the mitigation efforts by those who are skeptical about shutting the economy and said, no, if you're going to do this, you need to provide just compensation to the American people. This is like a taking under the Constitution. Think of it like just compensation. There's no shame in that. The government is responsible for the economic calamity that's being undertaken right now. Again, in 2 weeks, 10 million jobs were lost. That's more than the Great Recession. And I'll leave you with the close here. So if the doctors don't want to revolt, we still operate on the consent of the governed, after all, James Madison. And they still need to prove that what they're saying is real and as often as possible. So Dr. Fauci, please just order the serological test and, expand resources, get the antibody test. You can do it on a statewide basis. We don't need the entire country to be tested, although in Italy, one town did that, that they tested everybody. And they found that 3% of the population was infected with the virus. So what they did was they shut down the entire town, 3,700 population, Vo Eugenio, and they tested again, and they only found a fraction of that were still infected. They quarantined those people, they told them to stay at home, and then the town was basically ready to reopen with very few or no more cases. And so I think that, if you can get the antibody test nationwide and then everyone could be tested, that might become in handy, probably in September, more so. But you want to have that randomized study done so that we know it's safe to reopen the economy or to maintain what we're doing. Because you can find out that it's even more deadly. And again, here's the close. But to be certain, the data is already really, really bad. Again, the flu's top killing day was about 500. The mitigation there, the seasonal flu, are tens of millions of flu shots every year. The daily death tolls for this new virus could go as high as 4,500. Again, almost 10 times worse than the seasonal flu. And that's with the entire country shut down. We don't have a Chinese coronavirus shot. The national lockdown, that is our shot. That's the commentary. This is Robert Romano, Vice President of Public Policy with Americans for Limited Government, dailytorch.com. Hit that subscribe button, ring the bell for notifications, and have a good day.